Yes, beta, is it audio fine? Can we start? So first of all, congrats to all the students, beta. And now at this point of time, we are a little bit confused. Okay, what we have to do, which branch we have to join. So I will be just trying my best to give you basic things to decide at this point of time. Everyone. First of all, the most important query which I'm getting in my Telegram group or in my WhatsApp, okay, should I take a drop? So again, beta, what is the right answer to this question? What I will explain you. Okay, should I take a drop is again depends on your own scenario, beta. For this, what is the best reply I will give you? Should I take a drop? Beta, never compare with others. Don't compare yourself. Why? Because some students who are having strong backup, I'm using these words. Why? Because to give you a message, okay, just consider your own scenario. What are your family background? What can we afford a drop? We can't take a drop. Don't compare with anyone. Just decide yourself. If it is your first attempt, if this is your first attempt, you are not satisfied with your branch, you are eligible, or you can take one drop, 1 year drop, clear. But if it is your third or fourth drop, 2 or 3 years already wasted, and now you are not satisfied with your rank, I will advise you better to join the post-graduation. Start the new chapter of your life, which will definitely change the scenario, and you should not take the drop in that scenario, clear. So if it is your first attempt and you are not satisfied with your branch, we can take one option. Otherwise, it is better to continue. Clear, this will be the right. Now, the point is, whatever branch you will be joining, do justice with that branch. This is the big thing I'm telling you, because most of the students, they join post-graduation, then they never show the interest. Why? Because they want to do something different. And when they join the other branch, even then the satisfaction level is not there. So I will advise you, okay, whatever branch you are getting, do justice. These are the two important things which I want to share with you. Now, taking the first query, one student is asking me, okay, what is the probability of job after ENT in corporate hospital? When I take my words, after doing ENT, you will be having a good option of private jobs, but it depends on the city. Like you are in Delhi, Mumbai, it will be difficult to establish yourself immediately. But if you are in a tier B city, like you can say in the northern part, I take the example of Jaipur, or if you're going to some other cities, we can establish very comfortably, we can get job in the private sector very comfortably. Clear. Same in the medical college. If you say after the first day of my post-graduation, I'll be getting SRship in MAMC Delhi, is not practically possible, because already Delhi students will be there in the queue. I hope you're getting the message. So SRship, because many students, they ask, SRship in Delhi will be possible. So but SRship in Delhi, how it will be possible? The PG students, the students who have done post-graduation from Delhi colleges, obviously they will be there in the list. Yes, definitely you will be getting SRship somewhere in your periphery, definitely. It depends on the area. Like you have done post-graduation from the southern part, Karnataka. So there will be possibility in that city or nearby you will be getting SRship. But never have a dream okay, you are doing from post-graduation from the periphery and you are directly entering into Delhi, Mumbai. It will be difficult initially. But after a few years, yes, it is very much possible. Clear. So I will, as far Tier B cities are concerned, it is very easy to get private job. It is very easy to get government job. You will be getting some job in the district hospitals or in periphery. It is practically very much after doing your post-graduation. But I will advise you here one thing. After doing post-graduation, beta, dedicate few years to senior residency. That is mandatory. Because in post-graduation, you will not be able to learn each and every surgery. When you will do senior residency, definitely you will be on the next level. So I will recommend you not directly enter into the private or government job after doing post-graduation. Is it clear? Next, how ENT in the deemed colleges? One of the students is asking. I will be coming, Dr. Sahil, beta, I will be coming to your queries. Let us do one by one. So first question was, what is the job opportunity after doing post-graduation? I will recommend you to do senior residency, not job directly after post-graduation. entire B cities you will be getting, but in metros it will be difficult initially. But if you have done some fellowships, I will be coming to that point in next few minutes. Now, next point, deemed colleges. Take my word, beta, will be a again difficult decision. Okay, if you're not getting a government seat and you want to do from the private or deemed colleges, which college you are talking about? You cannot generalize deemed colleges. Which college you are talking about? How is the department there? That will decide. Clear? So ENT as a surgical branch, I will advise you better. Surgical branches are always better from the southern part of the country. If you are getting your opportunity to do post-graduation from the southern part, surgical skills are always better. This is simple funda. Clear? So, and language problem. One of the students is asking language problem. As to surgical branches, language problem will be there, but it will not be to that extent it affects your learning, because we have to learn the hardcore surgery. So as far as symptoms are concerned, you can learn the few basic words. वो हम सीख सकते हैं बेटा. तो कुछ टाइम में वो language मतलब adapt कर लेते हैं. It's not a big deal. प्लास्टिक सर्जरी, आई विल बी कमिंग ऑन दैट पॉइंट. क्लियर? साहिल बेटा, मैं उस पॉइंट पे आ रहा हूँ. तो पहले सबसे पहला हमने अभी तक जो स्टूडेंट्स आर जॉइनिंग नाउ, take the decision of taking a drop or doing the branch, because some students, because ENT, because this bracket ENT, opthal, anesthesia, these are the few branches where you are getting confused now at this point of time. And the more important confusion is, should I take a drop? It depends on your scenario. Decide accordingly. Clear? Whatever branch you take, do justice with it. Even my personal experience in 25 years back, I'm talking about. And our department, 1 or 2 PG students were there who were regretting of joining ENT. 2 PG students, me, my best friend is there. We work hard, and now we both are at that level where we feel proud to be a ENT surgeon. Clear? It depends on your attitude. So whatever branch you do, do justice with that branch. Coming on super specialty. So as for the guidelines, there are few areas where we can do super specialty. MS ENT will be eligible for that. There is a long list of these things, but the rules changes a lot. In 2023, they have given the rule, okay, yes, they are eligible, but I will strongly recommend you not to join ENT only because I want to do super specialty, I want to do MCH with it. No, don't do this, because some students who are not getting their dream branch, they say, sir, I will take ENT, then I will do super specialty. That is postponement. No, don't take only because okay, you want to do super specialty, because after 3 years, what's the scenario? How many seats are there? Nobody knows. So you are eligible, agreed. If you work hard for 3 years, you will definitely crack this MCH, but I will not recommend you to choose a branch only for doing MCH. I hope you are getting the message. Clear? So these are the important departments where you can do super specialty. Clear? Now, one of the student, Harshit, is asking how the ENT in government colleges. Always remember, beta, prefer government colleges. Why? Because you will get a nice exposure, nice patients, clientage will be there, so it will always help you. I always say better to join government institute than your deemed universities or private. Clear? Yes, beta, it is a good option. Clear? Now coming on after the next point, which are the important specialties after doing, because some students say after ENT what? As a faculty, I tell you, after 3 years, you have to choose whether you want to enter in the otology segment, whether you want to enter in the rhinology, or you want to specialize in laryngeal surgery. But अभी हमें लगता है सर ENT वो सर आपने 2-3 दिन में complete कर दी थी, इतनी छोटी सी branch है. But when you enter, then you understand which are the important surgeries, and at the last of 3 years you will realize okay, we cannot do everything. We have to specialize in one of the branch, either in otology, rhinology or laryngology. Clear? So this is, you have to decide what are the options. Pediatric ENT, yes, some students, some doctors, they go in pediatric ENT surgeries. Otology, rhinology, thyroid surgery, yes, we have many ENT doctors who specialize in exclusively in the head and neck thyroid surgeries. Facial plastic surgeries or skull-based surgery, they are the options after doing fellowships in these concerned branches. Clear? Now, next query. One of the students, Dr. Ritika, is asking peripheral government college versus DNP. I will advise you peripheral government college. Always better. Just follow this rule. If you are from a non-medical background, I will suggest you better to stuck yourself to the government institute. Why? Because you will be more safe. This is this rule, better golden rule I am sharing with you. If you are from a non-medical background, it's better, because in DNB there will be a big struggle for you. Passing percentage have drastically improved. We cannot compare the जो आज की डेट में passing percentage है is much better. Even then in government colleges बेटा you will be having some एक mental security के that I am going to crack the PG after 3 years. So I will suggest you peripheral, even it is peripheral. Go if you want to compare against DNB. So definitely, if you're not getting government institutes, it's better to join the DNB institutes. No worries. Clear? Next, scope of ENT abroad. So a very high opportunities are there abroad. Take my words. And being an Indian doctor, if you have done post graduation from India, you will be getting extra edge. Clear? But again, it will not be as simple. Because after doing your 3 years of post-graduation, beta, you have to do fellowships. Then only you will be getting opportunities. Fellowship, which options are there, I will discuss in next couple of minutes. Clear? Absolutely. After neurosurgery, in few countries, beta, across, especially in Europe countries, after neurosurgery, the ENT is one of the prime branch because skull-based surgeries. So again, if you have some backup, if you have some you can say vision is clear कि after 3 years I will go there, I will do fellowship. It is very nice opportunities are there. काफी अच्छे options है बेटा across the globe. Clear? So now I will suggest you to go for the master degree in your government college. बेटा DNB from the hometown against DNB from the metro. Yes, this is a nice query. DNB from the hometown against DNB from the metro. First of all, the government college. If I'm not getting government college, I can go for DNB. If I'm going for DNB, then better go for metro cities. Go for metro cities. Clear? Yes, समझ में आया? If you do DNB from the metro cities, your exposure will be next level. So I will not suggest you to take from the hometown. It is better to go from the metro. Your exposure, your learning skill will be next level. Clear? There's overlapping now. I'm coming to next query. Dr. Satvik is asking, there's more overlapping cases with other surgical, and I will add like medical branches, peds, surgery, they are overlapping cases will be there. So beta Satvik, ab batao, is it good or bad? It's a pro or con? If it is an overlapping cases, अब आप देखो, आप इसको नेगेटिवली ले रहे हो. आप कह रहे हो आपके ENT के cases surgery people will take or medicine people will take. I will take it other way around. Even all the patients, surgery patients or medicine patients, they will be coming to you now. वो भी तो आपके पास आएंगे. अगर आपके पेशेंट उनके पास जा रहे हैं तो you will be getting now. Why you are not taking it as an opportunity? It is a nice overlapping branch. It is a good phenomena. It's not bad, beta. So आज बेटा we are working in 2024. Even a patient coming from a remote village, he will go to the hardcore specialist only. वो दिन चले गए बेटा कि they will be going to a random doctor and they will get treated. Not possible. So I will take it as an opportunity. Clear? I hope you got my message. सात्विक बेटा ये तो अच्छी बात है ना, ओवरलैपिंग है तो बहुत बढ़िया है. थायराइड के केस आप भी करोगे, सर्जरी वाले भी करेंगे, जो बढ़िया करेगा वो डोमिनेट करेगा. ये सिंपल सा फंडा है. क्लियर? अब डॉक्टर गौरव कर रहे हैं काम की बात. वो कह रहे हैं सर ये बातें सारी छोड़ो, आप एक चीज बताओ, अर्निंग पोटेंशियल. बाकी बातें तो पैशन वैशन तो हम बचपन से सुनते आ रहे हैं. आप काम की बात बताओ कि मनी कितना इस ब्रांच में. टेक माई वर्ड, इट डिपेंड्स ऑन यू बेटा. देयर इज नो अपर लिमिट. If you are expert in cochlear implant, take my word, all those your non-medical friends, IT friends, जिन्होंने आपको complex दिया, you will earn that amount in 1 day or 1 week if you are expert in this. So there is no upper limit of earning, but again it depends on आप में दम होना चाहिए बेटा. आप कितना कर सकते हो, कितनी सर्जरीज कर सकते हो, कितनी एनर्जी लेवल आपकी, that depends on your. So earning is not a upper. Now if I have seen many people, they say this is a question I am coming to with. लोग बच्चे ने पहले पूछ लिया कि अर्निंग की बात क्या है, तो बोलो बेटा ये आप पे डिपेंड करता है कि आपने कितना हार्ड वर्क करना है. I have seen many ENT people who have their own setup. I have seen many ENT doctors who have more than 5 attachments. So it depends on you how much you. But there is no upper limit. Some people give a bracket. Okay, metro cities you will initially earn 1.5 or 2. There is no such guidelines बेटा. It depends on how aggressively you play after 3 years. देखो बेटा इस बात को समझो आप. 3 साल के बाद ऐसा नहीं होगा कि पहले दिन after 3 years HOD or any other hospital will come and will pay you. Not at all. You have to struggle. You have to polish your skills. Whatever skill which your branch you want to excel, audiology, rhinology, you have to expertise. And then you have to do some fellowships. It will be latency period of 1 year. हम कह सकते हैं कि 3 साल के बाद 1 या 2 साल अगर आपने अच्छी मेहनत कर ली, आपने you have done fellowships in good segments, so definitely you will be earning a good amount. Coming to the next one, Northern Railway Hospital DNB is good option, very good option. Your exposure is very good. If you compare, yes, beta, both are equally good. Both are equally good. Dr. Ayush, you both are equally good. Setup for the cost of ENT beta. आज की डेट में initially it is beta. What is the cost of setup? Is will be again a difficult question to reply. I will advise you from the very first day. Start your OPD. Simple funda. We can get OTs, but outsourcing. But we get initially start from the OPD. Day by day. देखो पहले 1 साल 2 साल में आपको धीरे-धीरे earn करना है. उस earning से ही तो हम setup करेंगे ना बेटा. और number, the quality of endoscope, microscope, what you want to keep in your OT will decide the cost. But initially I will not advise you कि यार 3 साल के बाद निकले आते में अपना hospital set करना है. Not at all. At least take 5 years of private practice or government job, then you start thinking about your private. Clear? So there is a latency period of 4 to 5 years जहाँ पे आपको efforts लेने, fellowships करनी है. You will be comfortable to, after that you will be comfortable to establish your own setup. Clear? Deendayal against Indore, it will be difficult to decide. Both are equally good. Both are equally. Whatever is comfortable for you, you join. Metro cities, again, if you want to compare, like I replied this question nicely, periphery against hometown against the metro DNB. First of all, government. If DNB, go for metro cities, only metro cities, because you have a nice exposure. Delhi, Mumbai, if you want to choose, go for Mumbai. Surgical skill will be on the higher side. Okay, this is a basic one. If you are getting Ayush, definitely better. St. Stephen's will be much better. It's a very one of the oldest institute. If you're getting DNP in St. Stephen's against you are getting MSENT in periphery, I will advise you to go for periphery, Government Medical College. But if you're not getting any such option, go for St. Stephen's, Delhi, one of the prime institute. Clear? But leaving a government seat and joining DNB is not advisable. I will not advise you. Clear? If you cannot learn surgery in DNB, but you will definitely. Why you will not learn surgery? One of Ayush is writing, okay, I will not learn surgery from DNB hospital. But the northern part, Dr. RN, northern part is good. If you are getting the option now, you tell me now which institute you want to compare. किसके साथ हमें compare करना है? Then only I can update you. Okay, it will be which institute will be better. Northern hospitals, Ayush beta, if you are getting DNB surgical exposure is there, definitely there. At one of the students is asking at 17,000 being a medical. You are interested more in MD medicine. Now you are getting 17,000 rank. Now you want to do ENT because it is a combination of surgery medicine. Not at all, beta. I will not advise you. Beta, you tell me, is it your first attempt? If it is your first attempt, 17,000, I will advise you, let us take one more chance. Because you are hardcore, your dream branch is medicine. But if it is your third or fourth, better to join. But you're not joining ENT, I want to do medicine part of ENT. No, beta. ENT, if you ask me, it is 80% of surgery, 20% of OPD, I will say. So I will advise not to join ENT only because I want to do only medicine part. No, it is better to take a drop and join your dream branch. DNB from the southern part, Bangalore, Hyderabad, against what? Ritika beta, against what? Against if you want to join government college periphery, go for the government college. Clear? Definitely better. There is a demand for super specialty in ENT. Why not? Why the government is giving you so many seats, eligibility after doing surgery after 3 years? Why they are making you eligible? Because there is a demand for super specialty. Definitely, so many medical colleges are being established now. So definitely they want a whole department of plastic surgery, head and neck surgery. So there will be, obviously there will be options. Clear? Now, Yes, beta, Dr. Bhattacharya is a good option. You can go for that. Coming on the next query, which one of the students is asking me, can you compare this branch for OPD and surgery? Beta, you can say, I explained, it is more of surgical part. You can say 70 to 80% is a surgery part. But if you want to go excel, less surgery, more OPD, obviously earning will be on the lower side. This is your choice. Okay, what you want. Now, I will explain it. Like, agar aap chahte ho, beta, I want mental peace. I want 9 to 5 job. So I will work more on my OPD. I want more money. I want to earn a lot. Comfort तो मैं बाद में देख लूँगा. आज मैं earn कर लेता हूँ. If this type of personality, you will work more on the surgery. I hope you got my reply. तो आपकी personality पे depend करता है बेटा. But what is the best part? What I always say, ENT is a mixed blend of combination of OPD and surgery. So you can decide, you can choose wherever you want to excel. Clear? But what are the other option, Dr. Riddhi beta? What is other option with which we will compare? Dr. Ayush is asking if I'm getting ENT, just can you periphery college of Northeast. I'm living in Pune and the option for DNB. Yes, this is a nice point. If I will explain, I will try my best to explain. You are from Pune. You are getting Northeast DNB. You're getting government college in the Northeast. Better to go for government or DNB. I will say in Northeast, beta, if you're going Guwahati, you're getting Guwahati, or you're getting Meghalaya, Shillong Medical College, these are good options. We can choose them over DNB. Clear? Because in government institutes, you'll be getting good exposure. You are from Pune, you're getting DNB from Delhi and UP. I will advise you ना, जब आप बेटा Pune से आप यहाँ आने का plan कर रहे हो, from your hometown, you are planning to come to UP. So why not to go to Northeast and join a government institute? So I will go for. What is the learning curve for it? Learning curve, microsurgery, Sahil beta, microsurgeries, it will take time. It will take at least 4 to 5 years to get expertise in the microsurgery, especially in the otology. Clear? So if you are a hardcore surgeon, okay, I want to do surgery, but I'm not getting surgery. I'm a surgery, I'm joining ENT. You can say big scope, head and neck surgeries are there. Otology surgery, microscopic surgeries are there. If you just want to confine to the tonsil and septum, that is your choice. Clear? Mild to moderate hearing loss is an issue for practicing ENT. Yes, better. I will definitely moderate hearing loss can be a issue. Better. I will again just Dr. Satvik. This can be a challenge later on. GMC Nagpur compared to DNB in Mumbai. I will go for GMC Nagpur. Definitely government college. Doctor, this is a clear-cut answer. Go for GMC in Nagpur. I will explain this in a nice way. I am getting a good institute of Mumbai. I say best institute of Mumbai. Clear? You are getting best institute of Delhi of DNB. Here I am getting some Tier B Nagpur, GMC Nagpur. My exposure in GMC Nagpur may be 10 to 20% less than these central metro institutes, which I can easily compensate after my 3 years. I can do fellowship, I can go there, I can do a job in that hospital where I'm getting DNB now for 6 months. You will compensate that thing. But if you're joining government institute, the passing, everything is on the safer side. So if you're comparing GMC Nagpur against best college of Mumbai or Delhi, DNB, I will advise you to go for Nagpur. Clear? I hope you got my message. Less hands on DNB, Northern Railway Hospital, Delhi. This Ayush, beta, एक चीज को समझो. Nobody will give you surgery on the very first day. Time लगेगा. First 1 year आपका एक ही काम होगा, OPD and to maintain the record of the patient. In the second year, they will be giving you surgery again depending on the department. But never expect जो आप queries पूछ रहे हो बेटा. Don't feel bad जो मैं उसको reply कर रहा हूँ. आप ये सोच रहे हो कि 3 साल में मैं सब कुछ सीख जाऊँगा. नहीं सीखोगे. You will be getting basic surgeries. They will not give you the opportunity to do cochlear implant in 3 years. They will give you opportunity to do tonsillectomy, septoplasty, mastectomy. और इनको अगर हम करेंगे with practice, You will be expertise in these three. मैं कहता हूँ 3 साल में अगर आपने टॉन्सिलेक्टमी, सेप्टोप्लास्टी and mastoid surgery सीख ली properly, and microlaryngeal surgery of larynx, you will be a good ENT surgeon. बाकी सब हम धीरे धीरे विद प्रैक्टिस सीखते हैं. और आप लोग मेरे से क्वेरी ऐसे पूछो जैसे 3 साल में हमें सब कुछ सिखा देंगे. इट्स नॉट प्रैक्टिकली पॉसिबल बेटा. सो मतलब हम रियलिस्टिक बात करें ना कि हमने 3 साल में अगर बेसिक सर्जरी विच आर ब्रेड एंड बटर, विच आर 3 ब्रेड एंड बटर, सेप्टोप्लास्टी, टॉन्सिलेक्टमी एंड मास्टोइड सर्जरी, इसकी भी हमने मास्टरी कर ली. सो वी विल बी ऑन द यू कैन से बेस्ट पोजिशन. Now coming on the next query, ENT as a private practitioner, can you share the daily cases, common OT? It depends on you beta, but it will take 4 to 5 years to establish yourself. You will have a good OPD, private OPD, very nice surgery, OTs, nice opportunities are there. From tonsil to your tracheostomy, multiple options are there. Low rank colleges drop and then good college. I am not getting your query, Gaurav. What you are asking, please elaborate. MS Opthal, MS ENT. But both are nice branches. It depends on you how to choose. If you ask me, I will definitely say ENT is better. If you ask ophthalmology faculty, they will say Opthal is better. So difference is head and neck. You can say microsurgeries are more in the ophthalmology. So if you are a hardcore surgeon, if you want to do surgery, that is your ENT is a good option. You can go for the ENT. Clear? Better Chennai, you can go for Chennai, Stanley Medical College, Madras Medical College. These are good options. ENT Ramchandra, good year. Chennai Ramchandra Institute is one of the fine institutes. You can go for that. Clear? There is high saturation. This is a common query. Saturation is high. But what do you mean by saturation? पहले तो हम saturation की बात करते हैं. ये ना एक हर बच्चा use word कर रहा है सर saturation. Because there is no such word like saturation. देखो मैं आपको explain करता हूँ. What is saturation? Like in a city, we have 2 doctors. One is well-established doctor, and you have just entered in that city, say X. And but your surgical skill, your communication skill are far better for if you compare with this established doctor. You tell me, with patient will come to whom? He will choose you now. So saturation will be for this doctor. Saturation will be for you. Saturation will be for those students who will not give their best performance. Saturation will be for those students who will not do justice with the branch. अब आप ये करो सर नेक्स्ट 3 साल एंजॉय किया आपने कोई सर्जरी सीखी नहीं और 3 साल बाद आप कहते हो सर वो ENT डॉक्टर दीपक ने बोला था there is no saturation. Saturation तो होगी but in next 3 years if you work hard 24/7 in the department, take my word, saturation will not be an issue for you. Will not be an issue for you. Clear? Medical legal aspect very good. But medical legal issues can occur in any branch. So I will say medical legal points should not be taken in consideration to decide the branches. Never ever. Clear? It is possible to get at 20,000 K in the peripheral college. Yes, but last college via state ranking. Ritika beta via state ranking, there will be opportunity that you can get. Clear? What is the balance of earning potential in metro cities? Very good potential, beta. Metro cities, you are having a work-life balance. I explained this query, Dr. Aaron, I am explaining again. It depends on you. If earning is your more priority, we will go for this side. Clear? If your mental peace is more priority, go with this side. So it depends on you. Work balance. Clear? Fellowships, many options are there. These are the few important fellowships we can do after the MS surgery, pediatric, otolaryngology, head and neck, oncology surgeries. Few doctors they specialize in allergy factors because these days this branch is again growing better. Mild tremors, I will not advise you to join any surgical branch if you have mild tremors. Clear? Facial plastic surgery, otology, rhinology, sinus surgeries. So especially आजकल sleep medicine better. These all again snoring management, skull based surgeries. So we can do 1 to 2 years fellowship in these branches, in these areas. Clear? But if you are having mild tremors, I will recommend not to. Why to take risk? Why? But later on you regret the decision. It is better now go for the medicine branches, medicine related branches. Clear? Transoral robotic surgery, these are new approaches which are coming. So why I am showing you these things, there is no upper limit. There is no upper limit. Take my words, better. Clear? Coming on the shortage, or you can say saturation you were asking. As for current scenario, private colleges, government colleges, there is shortage of ENT. Fellowships are available generally in our country, even across the country. Abroad you can get plastic surgery fellowships are very common. Cosmetic surgery you can get. Clear? So they are easily available there. ENT, I always say, is a big variety in itself. It is from small grommet insertion to tonsillectomy to reconstruct the baby's trachea. So this is a big opportunity for you. So let us take one more. I have seen vertigo patient taking general medicine. Yes, beta, you can. Okay. So these are the important pros of joining ENT, which I have explained you nicely. And again, I will recommend you 2 or 3 things at the last. One is here, decide your scenario yourself. Don't compare with anybody else. Clear? You should take a drop or you should not take a drop. It should depend on your scenario. If it is your first attempt, you are not satisfied, go with a drop. If it's 3rd or 4th, you should repeat. Again, briefing, what is nutshell we have learned. Government college should always given priority over DNP. That always clear. Even if you are getting a peripheral medical college, government, go for that institute. Saturation is not a challenge for hardworking students. Clear? And sometimes better. Honestly, I always share my experience, my own example to the students. I was a hardcore MD medicine student, but when I got ENT, one of my senior told me, okay, join and do justice with this branch. Now after 20 years, I realized, okay, yes, God has taken a better decision than me, and he make me join ENT. Now I'm very satisfied with this branch. So it depends on your how you do justice to the branch and have faith on the God. If you're getting these branches, go ahead and let's play nicely. Clear? Now next few queries. Can we go Australia after ENT post-graduation for working? Yes, beta, you can. Why not? There is a big opportunity for the doctors in Australia, and as for the last 2 years we are observing that their rules are slightly on the lighter side. Clear? So yes, we can do. If you are getting from the peripheral government, this is a nice query. How can we compare with a peripheral government college against private college in the metro? If we can afford the fees is not a challenge. I will advise you to go with the private college from the metro. If you're getting like last college of your state against the best college, private college in the state. So if fees is not an issue, we should go to a good institute, because these 3 years in a good institute will pay you rest of your life. Clear? I will advise, but Dr. Kajal, I will advise you to take MS from the private institute. Clear? If you are getting diploma from the peripheral government institute rather than MS from the private institute, it is always better to go with the MS from the private institute. Any other queries, better? Clear? So these are the important points as far as ENT is concerned. Clear? Apart from that, if you want to ask me any query, any point related with ENT, you can just inbox me. Yes, what is the difference between lifestyle of general surgeon and ENT? Gaurav, beta, aapna maje le rahe ho. There's, as such, nobody can tell you the lifestyle of ENT and general surgery. Clear? You want to take the lifestyle of what? Which lifestyle you want? First of all, explain me. Clear? Anji, tell me. It depends on beta, okay, lifestyle of general surgeon and ENT. No difference. Okay, so you can WhatsApp me on this number, any query. Clear? Thanks a lot for listening to me, and very best of luck. Emergencies, beta, as far emergency question is concerned, it is on the lesser side. This is one of the, you can say, advantage. Your emergencies will be on the lesser side, but it will be after 5 to 10 years. In the first 5 years, you have to deliberately have to take all emergencies to establish yourself. Clear? So thanks a lot for listening to me. We stop at this. Thank you.